Hi, welcome to Hatching for Health. I'm your host, Jessica Hatch. We are here to create awareness and bring about cures for children with different diseases, disabilities, and disorders. This family actually has a child that has childhood apraxia of speech. We've got Prescott, Jessica, and their son Clinton. Welcome to the show, guys.
Hi, thank you for having us.
Thank you.
So I want to start with, asking you a question, Prescott. When did you actually learn, first off, that he actually had this?
Well, the actual, we thought it was just delayed speech, and at 2 years old, we learned about the childhood apraxia of speech.
Would you say, just like on an everyday basis, like what are some of the struggles that you guys go through, having a child with this condition?
Communication's the biggest deal. He struggles, of course, getting things that he needs done or things that he wants, and then there's the struggle with his peers. Confidence starts to lack, that kind of thing. He has a communication barrier there. We're good at working with it.
Yeah.
Of course, with him all the time, but there's people that have never met him or only see him a couple hours a day.
Yeah.
And, it's just, that makes it tough on him, and he's so aware of everything, he understands it.
Yeah. So it's just that, that chance to interact like on an occasional basis that, he wants to kind of bring more, but it's kind of limited by what he's able to.
Yeah. And then 3-year-olds, they're not going to be aware of this kind of stuff, even if you try to tell them. So
yeah,
it's
The struggle.
It's a
school,
struggle.
Seeing him play by himself, it it hurts your heart just to see him like isolated.
Yeah.
So I encourage his teacher, as much as I see her, just please get everybody to play with him. But it's hard because they're so young; they don't know.
exactly.
And he just seems like he's kind of to himself, but really not. There's just a barrier that he is aware of.
Yeah.
And it's confidence uncomfortable for him.
As far as like actually getting the diagnosis from the doctor, I mean, how important was that in being assured that, okay, this is what my child has, and now let's go into full, medical care to actually assist in it?
It was everything. You need to hear that because you're maybe in a little bit of denial. You're saying, he's a late bloomer on this one thing. So once you get that diagnosis from a doctor, then you can jump, like you said, into speech therapy, occupational therapy, to where now he's in speech therapy 4 times a week, 30-minute sessions. And
Wow.
You get that early intervention. And, if we didn't hear that, we might still be thinking
just thinking
late.
he's delayed. Yeah.
And
So it's it's a very important to kind of,
yes,
get in front of the right person that, would have the experience to diagnose that. It sounds like.
absolutely.
We've got Stephanie here, who is a speech pathologist, and I'm going to have them interact a little bit in regards to the condition that Clinton has. I know we didn't actually define, what speech apraxia is, and I know that y'all have that definition very clear, but if you can kind of just tell us and then, go into a little bit about your background and how you feel like you can help.
Sure. So apraxia of speech is a motor speech disorder, and the underpinnings of it are neurological, and it's basically the signal from the brain. There's a glitch to the articulators, the lips, the tongue, the jaw, the vocal cords, the respiratory system, so that a child might know what they want to say. They have the idea, they have good understanding of language, but this signal just isn't making it to the articulators. So their speech isn't clear. Sometimes they're trying to talk and their mouth just isn't moving how they want it to. One of the red flags of apraxia as compared to other articulation disorders is that there's an inconsistency. And so they might say one word one way one day, and then the next day it might come out 5 times a different way. And so it's very unpredictable.
Is that some of the things that last part that y'all experience? Where
Yes.
yeah, I would think so. So your background, I know that you actively work with children that have apraxia of speech. Is that right?
I do. I'm a speech language pathologist, and I work with children with all different types of speech and language disorders, and one of which is apraxia of speech. I like what you said about the consistency of speech therapy and early intervention. I think so many children aren't speaking at a very young age, and parents aren't always sure exactly when they should be talking. And sometimes it's their first child, and some of the signs that parents can see is the child isn't cooing or babbling early on. They don't have their first words by 1. They're not combining words by 2. So if ever there are those issues, you go to your pediatrician, a speech pathologist, and some other specialists to determine what the issue may be.
Very good. Do you have any specific questions that you feel like Stephanie might could address?
Yeah, so with childhood apraxia of speech, are there any other red flags for other neurological disorders that we should be aware of at all?
It's a good question. So childhood apraxia of speech, it can be a congenital disorder, so something that just happened in birth and we can't quite identify what the issue is. Or it can be that the child had a stroke or a traumatic brain injury that injured a specific part of the brain that's affecting speech. So apraxia of speech is separate than other neurological disorders. It doesn't mean that there can't be concomitant issues, but we treat it in isolation.
Besides the delay of speech, what other signs is there to look out for childhood apraxia of speech?
So something you can look at, of course, I mentioned early language, early speech, the consistency and predictability of being able to say certain speech patterns. Sometimes children have chronic ear infections, and so that's something that you want to go to a good audiologist and ENT and rule out any hearing issues when they have those ear infections and fluid in the ears. They're not hearing the sounds needed for speech and to learn speech. Sometimes they might have to go to other specialists and occupational therapists, as you mentioned, and physical therapists, because they might have other things in their bodies that need some motor coordination help as well. But again, it's separate from apraxia of speech.
So, okay, those are great questions that both of you had. Is there anything else you wanted to highlight, Stephanie?
I want to say that we're talking about the very early stages of speech when a child is first learning how to talk. Some of the issues that you want to look out for are learning disabilities and reading disabilities, because a child is having difficulty learning how to speak and might not have those sounds in their repertoire yet. They have a hard time transferring the speaking sounds to print. And so you want to just make sure that you are aware that there might be some issues with reading later on. Also with learning disabilities, kids with apraxia want to be understood and heard, especially by their peers. And so they might say the few words that they know how to say. And so their vocabulary becomes very constricted and their grammar usage becomes somewhat constricted. And so they're not really practicing using language in the way that that most children are. So it's something also to keep track of as they're developing speech, looking at their learning and their reading as well.
Thank you.
Yeah, well, thank you so much. I do have another gentleman here. He's a MD, a family practitioner, and I wanted to also visit, but I definitely hope that we connected y'all so that y'all can be in touch, because she is local, which I think is great. I know y'all are Corpus Christi.
Close
But
enough.
definitely.
We make the drive anyway.
Absolutely. Well, thank you so much, Stephanie. I really appreciate your time and being here. So we're back with Dr. Masaji. He's a family practitioner, and we are bringing him in so he can also talk to the family a little bit about some of the information that he can share. So I know you guys had a little time to chat before coming on, and I just wanted you to kind of talk about some of those things so that the viewers can kind of engage in any information that you had to share with the family.
Yeah, we had chatted about neurologists, the fact that we haven't had a we've had scripts to go see them, and before she had mentioned stroke and trauma, brain trauma as possibility, like a link there. We aren't aware of any of that happening ever. What would be something that would help us find out?
So one of the things you could do is make sure you get an MRI. So we rule out certain things such as had maybe having a stroke in the past or any type of injury, traumatic brain injury. So it would be important to get an MRI to make sure you've ruled out those causes of this condition.
And would an MRI show, like, would you be able to locate a difference between trauma or stroke?
Yes, you would be able to tell an MRI whether or not it's from a stroke or will be from a trauma related. Yes.
Interesting. So you can actually look at that image and kind of determine if one of the two, or have via the radiologist and yourself kind of look at that. That's interesting. Would you say like a child at that age, obviously like the stroke, I think a lot of times those happen to people and don't even know it, but the other would be something where you would have seen him fall and, like actually.
I was going to ask that. What would be an example of a trauma like that he could have possibly got?
Hit the back of his head, or also such as conditions such as the shaken baby syndrome. Those are some of the things that you would watch out for.
I guess sometimes little boys, they hit themselves and they just keep playing and like no one
does.
knows.
Or if a lot of kids, drop off the bed, fall off the bed. So, those symptoms would usually happen after that event.
At least for peace of mind, get an MRI to see if there was trauma or stroke. Which
I think just even looking into his brain at this point and like the development of it, I think I'm surprised that that's not something like someone recommended already, but it sounds like it would be very beneficial.
Absolutely.
As the speech pathologist discussed, if you have a child who's having trouble with their speech or language, you want to make sure you want to get it addressed with your doctor. There are programs out there such as early childhood intervention, such as also known as ECI, that you can get them evaluated until we want to make sure that we're not missing these conditions.
Okay.
And on to something else real quick. When we talked earlier, there was also a gene that could have traced to childhood apraxia of speech.
Yes, there is a genetic mutation which has been linked to a lot of these disorders, speech disorders, including this one. It's called the FOX2P gene, which has been associated with this disorder. You would have to go and see a geneticist or a place which does all these genetic mutation testing and have them tested for that particular mutation.
Definitely something we'll be looking into
So that's what we're here to do. We're here to help children hatch for better cures.